one of my friends is a GP, and I was talking to her down the phone. I was like, do you think I'm just anxious and I'm just imagining this? She goes, no, Saima, you've got a shortness of breath.
Hi Saima, thank you so much for coming on the show on Too British to Be Asian. It'd be really good to kind of understand, like, as a doctor, how you've been dealing and controlling this process of possibly having corona.
Hello, thank you, Sharon, having me on. Yeah, we can talk about, start off with the symptoms I had. So we actually, I should start off, I'm an obstetrics and gynaecology doctor at London Trust. And it was around the second week of March. And we had positive patients. This is when cases were coming in quite slowly. And a few people from my department were put in self-isolation for the first 14 days, which is what the advice was before. I'd come to work because I was off on leave, I think, the week after this positive patient had been on our department. And the guidelines weren't very clear at the time. We were still kind of figuring out, whether we should be using PPE and.
Do you know what were the guidelines at the time? What were the guidelines
At the time, we were told not to wear masks or anything.
Oh wow. Okay.
The department were good. They were fast. They were trying to act fast. They knew things would develop, and they made it clear that things would change on a daily basis. That week we had quite a few meetings because one of the cases was the positive baby.
Yes, I remember that. Yeah.
Baby, yeah. So we had meetings about that, and I'm glad to say mummy and baby are fine as well, by the way. So that's good news. Anyhow, did the normal week, and then it was the Friday, so it's quite important. Friday, as I was going to work, and the whole coronavirus thing was building up on the media, etc. I just had a bit of a headache. Oh. That's all it was, and I just thought maybe it's the stress. And a lot of people actually report that. They actually say, "Oh, I'm getting a headache. I don't know if it's just the stress or the anxiety of all this kind of coronavirus or COVID-19 news that's happening." So I just put down, maybe it's psychological, and went through, did my clinics. No fever, nothing at that point. And there was a meeting upon meeting as well, because obviously things were going to change. And I started to feel a bit giddy as well, a bit dizzy. And I was like, maybe it's all these meetings. As medics, you're not the greatest of patients. And no, yes, my husband keeps reminding me. And I was like, oh God, I feel a bit like it is quite unusual. So I remember asking one of my midwife colleagues, she's a Alfreda, I said, can you get me the thermometer? I just want to check I'm okay, because obviously they were seeing cough or fever. Yes. And I wasn't having a cough at the time. I checked my temperature and it was fine. It wasn't fine, but then it was quite quick. Then towards the end of the day, I developed a cough, and I just started to cough. And I remember one of my other colleagues moved away from me as a joke. It was like, oh my gosh, I've got coronavirus. And I just thought, okay, this is just beyond a joke. And then the day finished, the last meeting, got in the car, I was like, okay, I'm not feeling too great now. Had dinner in the evening, and by 8 o'clock in the evening, I was coughing. It was a pure dry cough. And being a doctor, I've got everything at home. Yeah. And having children as well. Put the thermometer in and checked. It was the ear thermometer. Temperature was 38.
Oh my goodness.
That was 38, and that was it. I was zonked on the bed, and I remember just saying to my husband, I better self-isolate because I've been having this cough and it's now getting worse. Now I've got a temperature. Yeah. And that was the first of my 5 days of high fever. Yeah. And lethargy and just sleep. I've never slept so much in my life.
Oh wow.
So I completely isolated into the spare bedroom, and we're quite lucky. We've got bathrooms on each floor, including one. So I kept the middle floor, the first floor bathroom to myself as well. And I said to my husband, look, you know, the guidelines, because the guidelines were self-isolate within the house for 7 days. And that's exactly what I did. And the first 5 days was pure fever and this horrible cough. Now, I've had pneumonia before and I've had flu before. So you get coryzal symptoms, you know, in your nose, etc. There was none of that. It's a really odd.
Yeah.
Well, people show the symptoms in different way, they manifest in different way, but it was a horrible lingering fever. And I was literally taking paracetamols. I mean, it's licensed every 4 hours. I was having to take it every 3 hours.
Oh, wow.
Because my temperature would just go up. And the highest, I remember it going up to 38.8, which is not good.
Yeah.
And hydrating, I was forcing the water while I had the energy. And I had my phone device in there. And throughout the 7 days, you know, paracetamol, lemon water. My husband was amazing, left food in front of my door, made sure the kids didn't come in. You know, the kids are kids, they would come in.
And they miss their mum, you know, they miss being with mum.
Yeah, they were worried. Yeah. And it was, you know, it was, again, using the device. He was even meditating then as well, just to like, I remember wobbling at one point, just trying to stay in one position, just because it helps ground me. I'm a big fan of meditation as well. And I pray the Muslim prayers as well.
Yeah.
And I just remember I didn't even have the energy to stand up, when you pray salah. So I had to like do it sitting. That's how bad it was. And I was like, oh my gosh, this is serious, because we're young, right? When we get ill, we can still do things. So that was about day 5. Fever then resided. It was, and the husband was being great. And 2 days, I felt okay, it's getting better. And then during that whole 7 days, I kept in contact with the kiddies using FaceTime or, you know, the device. You know, kids love phones at the end of the day. So going on the phone and seeing if mummy was okay, and I had longer conversations with them like that way, which kind of uplifted them a bit as well. But I got, you know, people found out, husband told people that we're self-isolating, because this is before lockdown.
Yes.
And people were asking why my daughters weren't at school.
Yeah.
So then a lot of people found out, and it was so nice. A lot of friends and family were making food for us and dropped it outside the front door because we couldn't go out, and people were helping with the shopping. My husband's friends were amazing as well.
Oh, that is
so it was really nice. It was a nice, I mean, it was an awful, horrible experience, but at the same time, it was such a nice time where I could see everyone was helping. You know, there was that positive energy there. Yeah. So 7 days, come out my room hesitantly, because obviously we don't know what's going on with this coronavirus.
But also, like, how was your mental health at that point as well? Because were you worried? I mean, you couldn't get testing. I mean, you wasn't eligible.
So I was in contact with my one of my consultants who was speaking to me on a regular basis. I'm grateful to her, because that actually helps as well. And they were all quite concerned, because I mean, a few doctors were ill like this, but some just had a bit of flu kind of symptoms and recovered. So there's been quite a spectrum of the way we are presenting with this virus in hospital. So they just said they weren't going to test. And my husband didn't understand it as well, because on the news and the TV, they're saying they're going to test frontline workers. And I was symptomatic at that time, and they said, no, we can't test. I rang the A&E department where I worked, and they said, please don't come in, just self-isolate. And I was quite worried, like, what if it develops into something? I mean, the deaths weren't as much at that point. But when I look at the news now, like Mr. Boris Johnson. So basically, I got well, and around day 10, 12, when I spoke to you, I think it was that day, I just deteriorated again, and I developed shortness of breath. And because I've had pneumonia before as well, I know how that it feels. It wasn't as bad as my pneumonia, but it was noticeable.
Do you think that was anxiety? Do you think that was like part of your kind of like?
But that's what I thought. I remember one of my friends is a GP, and I was talking to her down the phone. I was like, do you think I'm just anxious and I'm just imagining this? She goes, no, Saima. You've got a shortness of breath. You know, but then why is the A&E doctor telling me, oh, you're fine? You know, just stay at home. Maybe I am getting anxious. I don't know. But what we're finding now, with a lot of the cases, not all of them, but they what they do, we measure our observation. So we measure our pulse.
Yeah.
We measure our saturation. So they put a little monitor on your finger to see how much your blood has been oxygenated.
Yeah.
So my pulse was quite high when I was having fevers. So it was around 120, which you would expect, or 100, should I say, not 120. It was around 100 during the fever, but normal again, around 80 when I was feeling a bit better. And when I did eventually go to A&E, my saturations were actually, 90 to 100%. I was like, well, why am I short of breath?
Yeah.
I even listened to my own chest, believe it or not, but my stethoscope, and I could hear the crackles, as we call them in medicine, at the back. So I was like, oh God, I've got to go to A&E because we've had positive patients. We've seen how they've deteriorated. And so around day 10, after thinking I was well, I did, felt unwell again, like Mr. Johnson. He felt a bit better apparently, and now, he was feeling unwell again.
Yeah.
And I went to my local A&E, and they said, well, you can talk. I was quite short of breath. And my GP friend said to me, you go right now, go and get checked. You just don't know. And they turned me away.
Oh, no.
Even because... because I'd been ringing 111 and they were like taking 40 minutes, which is understandable with volume of calls I'm probably dealing with. But my husband's like, look, I'm taking you in, and my GP friend kept calling back because you need to go in. So I went into the COVID hub area of the A&E, and he, a nurse came with, a gown, and I said, I'm feeling really unwell. I'm actually, I felt better, but now I'm getting worse. I'm concerned. He says, well, you're able to talk, you're not too bad, so I think you should go home and self-isolate. So my GP, she's my best friend, and she's a GP as well at the end of the day. It could be her at the end of the 119 as well, not giving me advice. This is her saying, look, I've been touched because we've been in contact throughout the whole time of my isolation. She could hear the difference, but I was speaking to other doctors. They're like, well, you speak the full sentences, which I don't think I was able to.
Right.
And then this is why I started questions like, am I just causing anxiety? This is what. So eventually I got through to 111, told the GP on the line what had happened, and he was horrified when I told him that I was turned away.
Really?
And he said, please, can you go back? I said, I'm not going to that anymore. I'm sorry. In my as I was trying to speak, and I requested to go to another nearby A&E where I used to actually work, so it's a familiar place. I know where to go straight away, and I went there, and one of the A&E registrars I actually knew from when I was an SHO there, and she was lovely. She saw me. Chest X-ray was done, bloods were done. And she, prescribed some medications and also an inhaler as well to help with the breathing. But they checked my saturations. They said, look, it's fine. We don't know why. You may be developing an infection as well, so gave some medicines for that as well. So, I was seen quite quickly there, and,
but that was because also, like, you were a doctor, so you did know where the best place to go for you was. But like for kind of people that don't know, and they're being sent away, that's quite concerning. But again, we're probably talking a bit in the past, because obviously now I think the situation has changed, because you're actually you're not actually at work yet, are you? You're still at home.
So I'm still recovering. So after the whole fever and the shortness of breath, I've had a hacking cough, is how I can describe it. It's an awful cough that has been going on for ages and ages, and lots of honey and lemon. Honey and lemon have helped, and black pepper and all other kind of potions everyone's been advising. And it's only just now my cough is settled, I have to say. And like I said, my department's been really supportive, and I don't really want to go back with a cough.
No.
Patients will be horrified in this kind of environment we're in, and so I'll be going back in next week,